I have with me today Louise Trewern from Torbay in England. Louise is a chronic pain sufferer. She has fibromyalgia and osteoarthritis. But Louise came to my attention through the British Pain Society, and in discussions we've had with her, she is one of the pain patients who have come off of opiates altogether, and yet she finds her life better with that. Hi, Louise.
Hello.
So you have suffered from chronic pain for how long?
Most of my life. And I mean, it started when I was a child, and the doctors would tell my mum it was just growing pains and I'd get over it. And I never did get over it. I mean, obviously, when I was a child, it was a bit easier to cope with. Until it came to doing things like taking part in sport. I couldn't do that. I was a very sickly child. I had a lot of episodes of chest infections and colds, and despite the fact my mother gave me a fairly healthy diet, there was no obvious reason why I was a sickly child. So that was where we started down the road of, well, I really don't know what's the matter with me.
I think it's often the way with fibromyalgia type illnesses. And in those days, the doctors were even less aware of the underlying condition. They blamed anything and everything but fibromyalgia.
And there was no other answer for how to treat me. I mean, obviously, as a child, painkillers weren't offered up as an option. But I can remember, even now, I can remember being awake at night with pains in my arms and my legs and crying with this pain, which would have been the prompt for my mum to take me to the doctor. And we had a really lovely family doctor who was really caring, but he had no answers and just put it down to this growing pains, which I must admit at the time, even as a child, I remember thinking, oh, that's all right then, it's normal, everybody gets it. But it just never really went away. It wasn't constant, but in the fact that it wasn't 24 hours a day, but at the typical times that you tend to notice now as an adult, when you rest, it all starts to hurt. So if I went to bed as a child, I couldn't sleep at night because I was in so much pain.
It's a very similar story to me. It was all blamed on growing pains when I was about 11 or so. I can sympathise with you there. And the doctors then, of course, I suppose I was angry for a while, but you can't blame them because they didn't know any better.
No, that's it. I think, I suppose in every profession they learn as more years go by. And it wasn't until I was in my 30s that I first had any mention of fibromyalgia. So, that's a huge chunk of time. And in that time, from the time I was a child with the growing pains to the first mention of fibromyalgia, I cannot imagine now how many different times I went to the doctors and they sent me for this test and that test, and I had all these weird and wonderful things come up that, to be honest, I think people around me thought, oh, hey, she's a proper drama queen. What's this illness she's got now? There's never any evidence of this, only what she's telling us. And you start to think that perhaps you are a bit mad. Are you imagining these things? Because when they send you for a test, the test's negative or inconclusive was a one that used to come up on my notes very often. But I'm sure people can appreciate when the GP says to you, oh, well, we'll send you for this test because there's a very small possibility it could be this. You go away quite terrified and you look up what that is because it's just in our nature. People might say, oh, don't look at Google. And we didn't have it back then, of course. No. The medical encyclopedias, and you would look it up and see what this thing is that they think you might have. And then you've got the waiting time from when they sent you for that test to when it comes back with the inconclusive or negative, and you're dashed back down again because you think, on the one hand, phew, I haven't got that nasty thing. But on the other hand, what on earth is it? So it's just a constant merry-go-round of ups and downs, tests and no answers. And when that's going on from a child up until your 30s, it's quite soul destroying. And by that time, of course, like most people, you just want a fix. You just want that magic bullet that's going to make it go away.
Is that when the opiates came into being then?
Around about that time, it would have been, yeah. I mean, I think that I can remember I was a single parent with 4 children trying to work full time in a care home. And I woke up one morning and I couldn't move. My back was completely locked up to the point, it was quite terrifying. I could literally not move. And the only way I could make myself move was to very, very, very gently rock from side to side until I could get enough movement to flip onto my side and then start to wriggle in the bed to loosen up my back enough to sit up and then take some paracetamol. But I was, again, crying with the pain. So after several times of this happening, I went to the GP and we started down the road of trying to find a painkiller that I could take at night that would still be working in the morning when I would wake up. And of course, there really wasn't anything. I would take something at bedtime when I didn't have the pain. But by the morning when I woke up completely locked, it had all worn off. So what was the answer? Opioids, slow release opioids. And I think at the time, the first course of treatment was the old MST slow release morphine. Okay. Quite a low dose, but it was just like hallelujah. And I didn't feel too bad. I didn't feel drugged up. I didn't feel anything other than relief. And I was able to get back to my life, work, look after the family, get out of bed when I needed to, because I was quite terrified previous to this. If the house caught fire, I wouldn't be able to save my children because I couldn't move. And the morphine meant that I could now. And so on the one hand, I wasn't interested in looking any further. I'd got the answer. I had a busy life. I could crack on. But looking at it from another point of view, neither was anything else offered or suggested. So I wasn't given any information about the risks of being on this medication long term or alternatives to how I might get back more mobility in my back without medication or even along with the medication. Because with hindsight, I think that would have been a better course if they had said to me, well, this is a short-term answer, but you can't stay on this long-term, so we need to get you some proper therapy that will mean you don't have to be on it. That never happened. So gradually over time, the dose got increased and increased because, as we know, the longer you take it, the less the efficacy fades and you need to keep upping the dose. Or at least that's my experience. But I think where the story changed, I mean, we're talking over a few years now that gradually this went up and up. Where it changed was I went to the GP, I think about something entirely different because I was starting to get all these weird, the weird symptoms still kept happening. It didn't cure anything. It just gave me pain relief. I went to the GP one day and he said that they'd had a rep in to see them and advised them that the patients that were taking MST really needed to stop that and go on to OxyContin. And now it's my wife's recollection that is where the problem started. I don't really recall the difference. And I think the difference is insidious. I think with all my personal opinion is that we all believe the opioids are working and we can't manage without them. And we don't notice when the switch happens from it working well to it causing more problems than it should. I can't tell you when that happened for me. I was on them in total over 13 years and ended up on really high dose. I was taking OxyContin twice a day. I was backing it up with Oromorph liquid up to 4 times a day for breakthrough pain. And on top of that, I had 2 antidepressants that were supposed to help with various types of pain. On top of that, if I had a really bad day, I was taking dihydrocodeine. And just to throw something else into the mix as well, when I had really terrible issues with anxiety, I had diazepam to put into the mix as well. So, I was on a real cocktail of drugs by the end. But I can't tell you when it stopped being effective and became a nightmare.
You said there that the opiates made things worse. In what way did they make things worse for you?
Well, again, a lot of this I've since learned in the 3 years I've been off the opioids and been working with pain teams and different pain specialists up and down the country, that a lot of the symptoms that I was experiencing weren't as a result of my fibromyalgia. They were as a result of long-term use of opioids. If you don't have a clearly defined reason for your pain, if it is something that could be a multitude of things under the umbrella of either fibromyalgia, CRPS, one of those, then I think we make the common and reasonable assumption that the things that we're experiencing are as a result of that condition worsening, having a flare, rather than the more obvious thing to someone who's not in our bodies, that it's a side effect of the drugs you're taking. But in actual fact, if you sit and look at the list of side effects of long-term use, you can probably, like I said, for myself, I ticked them all off, and they ranged from repeated infections of various kinds, skin infections, throat infections, chest infections, urine infections, every kind of infection you can possibly imagine I had, with endless courses of antibiotics and steroids on occasion, and of course the stress that puts your body under as well, being on these things. And I definitely had this thing they call opioid-induced hyperalgesia, which I thought was just my fibromyalgia again. I couldn't even tolerate the cat walking across my lap because the pain in my legs was just unbearable. And if someone in play just nudged my shoulder, oh my God, it was as if they thumped me. And also noise. I couldn't bear loud music in the house. I couldn't bear more than one voice talking at one time. I certainly couldn't bear my children coming around with their children, because the assault on my senses was just incredible. I couldn't cope with it. So I needed complete silence, which looking back must have been really stressful for my family. And so all the senses became ultra sensitive to everything. So noise, touch, taste, smell. I had weird issues with my nose infections, and either I couldn't smell or I would have weird smells. Just the whole lot I had. And of course, topped off in the end by the most unreal constipation I'd ever experienced in my life. And 2 emergency admissions to hospital was the final straw, because I was taking sachets of stuff that was supposed to prevent constipation, but I can remember which worked. They seemed to, that I didn't have an issue as long as I took these sachets. I had district nurses coming in, paramedics coming in, on-call GPs, until on the early hours of the Monday morning, they decided to call an ambulance, and off I went to Torbay casualty, and then into theatre. And I can just put the whole experience that it was the most embarrassing. It was just the most thoroughly hideous experience I'd ever had in my life. And that happened twice in quite a quick succession. I think within the space of 2 or 3 months, I had another episode, and I decided that's it. I was told in theatre, the team were just lovely. They tried to make me feel as relaxed as possible, but it was just hideous. But they told me that that was a common occurrence for people on long-term opioids, and I just could not believe that. I could not believe it. I felt with the pain like I was going to die. It was that extreme, despite all the opioids I was taking. Unfortunately for me, when these admissions happened, I had already been sent along to the pain team at Torbay Hospital, because previous to these emergencies, I'd been to the GP in tears again because my pain was so bad and I wanted more. And he'd reached the ceiling of his capabilities prescribing this stuff and had to refer me back to the pain team, which actually I believe now saved my life, because I met the most wonderful clinical nurse specialist who started to introduce me to the idea that what I was experiencing was long-term effects of opioids, and she started giving me all the information from the Opioids Aware, all the evidence, if you like, rather than just what she was saying, so that I couldn't really argue with facts. But I did. Initially, I told my wife I hated her. I hated this woman. What was she talking about? How could she possibly think that I was going to be able to cope without these opioids? It was the only thing that was keeping me going. What a ridiculous idea. And I would leave her office in tears. And so when these admissions happened, these emergencies, she sort of pointed out that this really was, again, another side effect of long-term use, and it was only going to get worse. It wasn't going to get any better. And if I wanted to get off these drugs, then this gave them the criteria to get me into community hospital, which was a new thing that they were looking at doing, to come off rapidly. And I was all up for it. By this point, I felt like I had nothing to lose. My life was terrible. Now, this is only my own experience, but I seriously felt like my life was down the toilet, literally. I mean, I got up to 25 stone in weight, despite my best efforts to try and lose it. I was in the most incredible pain. I wasn't going anywhere, I had no life. My wife was my full-time carer, and it couldn't be any worse. So I said, yeah, whatever. I just want to get off this stuff the quickest way I possibly can, and I'll go through whatever I need to go through to achieve that.
Were you admitted to hospital then, or was this system where you stayed at home but kept in touch with the hospital and reduced your opiate dosage weekly, monthly?
So what happened for me, I mean, it makes it sound, as we're talking, like this was a really quick thing, but it wasn't. I was seeing the clinical nurse specialist for I think it was almost a year. And during that time, she was introducing the idea that I should reduce the drugs. That was the initial idea. And we started off, which I think, looking at it now, was their way of sort of getting me to show motivation to reduce the amount of oxycodone liquid at home. And we would start that way. During this time, I had the emergency admissions. And then they said, well, actually, how about we just have you into hospital and get you off this stuff fast? So then it was a case of waiting for a place to come up in the community hospital. And it was pointed out to me that I would be the first patient that they would have done this with. I had a phone call from the ward to say, right, we've got a bed for you. We need you in here in the next few hours. And I went in on the Monday morning and I saw the consultant, the pain consultant, and the clinical nurse specialist that had been helping me. They were going to be my team, if you like, and they had made clearance in their diaries to make sure they could be with me at least once a day and he halved my dose overnight on the first night. And he promised me that the next day I wouldn't be in any more pain than I was already. I didn't believe a word of it. I thought, yeah, right, okay. But again, as I said, I felt like I had nothing to lose. And he was right. I wasn't in any more pain. Yes, the withdrawal started to kick in pretty quick and was pretty hideous, I won't lie. But they gave me a couple of drugs to sort of counteract that initially. One, I believe, was a drug called clonidine, which helped control things like the restless legs and what have you. And he halved it again on the third night in hospital. And I think I left hospital at the end of the week on something like 10 or 20 milligrams left to taper, which I tapered over the following 2 weeks, I believe. So I was off it altogether within 3 weeks. And let me be clear, it was rough. It was a rough ride, but I was aware of everything that I was going to face. I had support from both the consultant and the clinical nurse specialist. Initially, I was speaking to her on the phone. I spoke to her the day after I got home from hospital, and again over the weekend on the Monday, spoke to her again. And it was sort of every few days, and then it gradually went to weeks and then months. So I had a lot of support, and it wasn't easy. And my wife, bless her, went through hell, I'm sure, with watching what I was going through. I would be sat hiding under blankets. 1 minute I would be hyper, the next minute I would be in floods of tears. But what kept us both going was the instant results on other things. Pain, lot less. Where before I couldn't stand any noise or any music or anything in the house, now I wanted loud music. And I think one of the differences was while I was in hospital, and this was people talk about a light bulb moment, on I think the second or third day in hospital, the consultant said to me, look, to try and counteract the withdrawal effects, pace the ward. So when you feel like you can't cope, of course in hospital you tend to be sat in bed. He said, get out and pace the ward, and that will fire the endorphins, the body's natural painkiller. And because I was 25 stone and used to sitting in my armchair all day, this movement just of pacing the ward did give that effect of the endorphins, and it felt good. And I did do it. And much to the nursing staff's sort of, they couldn't believe that I would be morning, noon and night, pacing the ward, earphones in, music going. And that was how I coped. So when I got home, that continued. Of course, I didn't have the distance of the ward to pace. So I would get up when I couldn't sleep in the middle of the night, put the headphones in and dance in the living room, luckily where no one could see me. But, it gave that same effect of the endorphins, the feel-good factor, and I could cope. When I ran out of space in the living room or got bored of being in the living room, we would drive out to somewhere flat and walked along the seafront there, which was flat, which I could do with my wheelie walker. Again, all hours, whenever I needed to do it, we would go and do it. So that was where the walk-in for pain relief started. It was my light bulb moment in the hospital with the endorphin thing was like, oh, wow, this really works. And that was where I started to realize there were other ways I could manage the pain.
So how do you cope with the pain now?
In the first 3 years after coming off the opioids, to start with, all I would take was some paracetamol first thing in the morning for that typical fibromyalgia stiffness. And I think I must have been doing that for about a year and a half, when I suddenly thought, hang on a minute, do I actually need that? So I stopped taking the paracetamol as well, and lo and behold, I didn't need it. So, of course, I still have fibromyalgia and I still have arthritis, and the pain some days is quite crippling. But I have to say, and again, this is just my own experience, but I find that once I've got up and battled through that initial, oh my God, I'm stiff as a board, that period, and got moving, it eases. And so as long as I can keep moving during the day, I keep in control of that pain. Of course, there are times, and I think there are other factors that play into when our pain has a flare, when I might have increased stress for some reason, or I might not be very well for another reason, and that all ramps up our pain experience. So there are the odd occasion where, and it's quite rare, where my pain might be so bad that I feel like I want to take the paracetamol again, or on when I've had an acute episode, like falling over my bootlaces in a car park, breaking my finger, I reluctantly took some dihydrocodeine for 2 or 3 days to get through that acute period. But of course, because I'm now off opioids, I'm very anti-opioid unless it is severe. And then I do know that it is, the evidence is there to say that in acute episodes, you're all right with a short treatment. It's not like they can give me some dihydrocodeine and I'm going to be instantly addicted, dependent, whichever word you prefer, instantly again. You need to be taking it for several weeks before you're opening yourself up to that dependency again. So I will take that in an acute period. But no, on the whole, I don't take anything on a regular basis.
That's a remarkable difference. And again, I see parallels with my own life. I have been on oxycodone for many, many years now. And I can't imagine not being on them for the pain. The constipation is as bad as yours, if not worse. I've been in hospital more than twice with it. It's quite horrendous, as you say. You double up in pain. That gastric pain is like no other.
Oh, yeah.
You just can't help but double up. I've had ambulance men come to the house shocked at the screams I'm making and the guttural sounds you make. And as you say, you feel like you're dying. And I was very much a proponent of being allowed to take opiates and not having opiates stopped. But the more I have learned lately, I do wonder if, as you say, they shouldn't be prohibited completely. They should be there if you need them for short periods of time. But I do wonder if they do actually do more harm than good over a long period of time.
Interestingly, one of the GPs I work with said to me that the thing with opioids is it manipulates the brain into dependency. So therefore, without even consciously thinking about it, you are going to argue black and blue that you need those drugs. So I wonder, does that make us capable of making a balanced judgment on whether or not they are good for us? Because I, like many, many people, would have had a stand-up argument with you that I needed the opioids, and if you took them away from me, my life was going to be awful. And I would have argued black and blue about that. No two ways. What needs to happen is, firstly, people shouldn't be terrified that their drugs are going to suddenly be stopped. And we know for sure that that is extremely dangerous anyway. It needs to be done in the slowest possible way for people, for each individual to be able to cope with those side effects, because they are not nice. And I think oftentimes the tapering schedules that people are given are way too fast. I think there comes a point when a clinician, whether it be a pain specialist, a GP, a prescribing physiotherapist, whoever, they can see clearly that the evidence is there to say that the drugs they are prescribing you are actually harming you. So where clinicians are having problems at the moment is because they've been trying to have those conversations, and because of the strength of the dependency, people aren't willing to engage in that conversation. So when should there be the decision made to enforce that taper, which I don't like. I don't like the idea of that. But since doing the work I've been doing, it sort of made me realise that for some people, even though the evidence of harm is there, they are never going to engage or agree that the best thing for them is to stop. So what happens if the GP or whoever is prescribing that drug lets the person continue on that drug and then something awful happens and they die? Whose fault is that? That's that sort of makes me think then that there needs to be a cut-off point somewhere along the line. I think if GPs or whoever has made as many efforts as they possibly can reasonably can make to engage with that patient and they refuse, then they need to sort of start a very, very slow enforced taper, I believe.
Personally, again, I think you came off them very rapidly.
Oh, yeah.
And I wouldn't recommend that to anyone, but I do think a slow taper is certainly more beneficial. I came off pregabalin. Some say quickly, I didn't think so. 6 to 8 weeks, I think I came off pregabalin. And I'm a completely different person. Completely different person now without them. The pain's worse, but I can think and I can speak.
Yes.
If you'd asked me last year what I thought about this, I would say, "Oh no, I need my opiates. I'm entitled to have them. They're the only thing that's helping me." But I do wonder now. I think I would need the assurance that if it didn't work, then I would be allowed to go back on them again.
Yeah, and I think I'm told there is evidence that people that take substantially low doses of opioids do manage to live a productive life. And in fact, for people that have quite complex conditions, that works really well, and there isn't any evidence that it's harming them. So I've got no problem with that. Where I worry is that I don't know when the difference between it working really well for me and it causing me more problems. I don't know when that switch happened. Treating pain, there is no one size fits all, and each person's case should be judged individually. What works for me might not work for the next person, and vice versa. And I think clinicians need to have the range of treatments at their fingertips to help each person individually. And I think if you take a lot of these things out, off the table, it really leaves limited resources there to help people. So I'm definitely not anti-opioid, and where they're prescribed really well and there's no evidence that it's causing the person any harm, then it should be an option. But I am an advocate for making sure that people are given all the information about that drug, the risks, the implications of taking it long term, or even at all, not even long term, but taking opioids at all, and the alternatives that are there, even down to pain education, which I passionately believe people should be given at the beginning of their pain journey. I didn't understand anything about how pain worked, and I firmly believe if I knew then what I know now, things would have been completely different. I certainly wouldn't have passively taken these drugs for years on end, not looking for any other alternatives. So I really believe people should be given the information and the education to make better decisions along with their healthcare team for what's going to suit that person. I don't think you can say, right, well, there's no evidence that this works, so we're going to stop giving it to you. What's going to happen if that's the case? People are going to be in so much distress. It just doesn't bear thinking about.